Hi guys, my name is Tiffany. I am a certified family nurse practitioner and telehealth expert, and I help nurses monetize the expertise and knowledge that they already possess to start their telehealth practice and enjoy unlimited PTO and unlimited income. Today, I want to talk about the potential revenue that you can generate if you start your own telehealth practice from anywhere that you currently are. For the example that I'm going to use today, I am using an NP that is making $130,000 a year. I am very aware that some of you make less than that and some of you make substantially more than that. However, for this example and this comparison, I am using $130,000 salary. When you take $130,000 as a salary and you divide it by 2,080, which is usually the number that is divided by, that's 40 hours a week for 52 weeks, you get an average of $62.50 per hour. So if this nurse practitioner worked 5 days a week, ideally, this is also just an average number, you would see 20 patients per day in a clinic setting or urgent care as well. So 20 patients per day. Let me say that again. $130,000 in salary equals $62.50 per hour. If that NP is working 5 days a week, averaging 20 patients per day, that's about 100 patients per week. Her pay is about $2,500 per week. All right. So now our hypothetical nurse practitioner has decided that she wants to launch her own telehealth practice on the side. So in telehealth, if you learn how to properly structure your telehealth practice, your average revenue per patient or per client is about $86. That should be your goal at least. You set your own prices in telehealth, so it could be less, it could be more. $86 is your average interaction. So 6 patients per day, 5 days a week will give you 30 patients per week. 30 patients per week will give you $2,580 per week. Now, just to remind you, the full-time employed practitioner is making about $2,500 a week, seeing 20 patients a day, which is 100 patients per week. The telehealthpreneur is averaging about $2,580 per week, seeing 6 patients a day, 5 days a week. So for this example, like I said, I chose very simple numbers. Average, I feel like everyone can resonate with that. If you are practicing in a clinic or you're a practicing nurse practitioner in general, you're not too far off that average. And so you can kind of resonate with it. However, that is part-time. Did you hear me say 6 patients a day? It does not take 8 hours a day to see 6 patients a day, okay? And if you learn how to structure your telehealth practice to generate revenue without you being at the computer, out of those 6 patients, 3 of them can be, you didn't have to do anything. You didn't have to sit in front of your computer in order to treat those patients, okay? There's so many different avenues that you can go and so many different strategies that you can implement to reach this 6 patients a day. So to summarize, you can generate full-time revenue working part-time in your telehealth practice. I hope you found this valuable and I hope you found this information helpful. If you did, please tag your NP bestie. Please share and subscribe because I want to continue to help you on this journey because you deserve unlimited PTO and unlimited pay. See you next time.